Good morning. My name is Glenda Rogers, and I want to welcome you to the WellMed Charitable Foundation's Caregiver Teleconnection. We have a very interesting session for you today. We have Dr. Bendheim with us today, and he's going to be talking about Alzheimer's and other dementias and how to prevent them. So before he gets started, let me tell you just a little bit about him. Dr. Paul Bendheim is a board-certified neurologist, clinical professor of neurology at the University of Arizona College of Medicine in Phoenix, and he is the founder of BrainSavers Brain Plus Body Total Fitness Program. His undergraduate degree is from the Pomona College, where he graduated cum laude with a major in art history. He then attended the University of Arizona College of Medicine in Tucson. He received his medical degree with honors. He trained initially in internal medicine and then completed a neurology residency and postdoctorate research fellowship at the University of California in San Francisco. He has lectured around the world, published numerous scientific research articles, and is the author of the book, The Brain Training Revolution, a proven workout for healthy brain aging. Paul, welcome to the call today. We're so anxious to hear what you have to say.
Well, thanks very much, Glenda, and thanks for those kind words. And let me extend a welcome to everybody who's joining. I think this is the third podcast I've done for the WellMed Charitable Foundation and the Caregiver SOS program. It's good to be back. There's a tremendous amount of material to cover. I've tried to boil it down to nutritional sizes. Let's get started. The first thing I need to do is note that I do have an equity position in BrainSavers. Glenda mentioned the company and our program, and we've been very fortunate to have the WellMed Charitable Foundation sponsor the program at a number of their seniors community centers throughout the state of Texas. So I think you're all here because we all share a concern about losing our memory, having our brains perform suboptimally as we grow older. And this fear of declining memory, declining brain function, and specifically this fear of Alzheimer's disease has risen to the top of concerns of aging Americans. And it was really propelled into the public discourse when President Reagan went public with his diagnosis of Alzheimer's disease. So I recognized, well, let me go back. So as Glenda mentioned, my training is in neurology, and I did a postdoctoral fellowship in a rare cause of dementia, Creutzfeldt-Jakob disease, popularly known as mad cow disease. And so my lifetime professional interest has been in dementia and how I and others might help those suffering, and furthermore, come up with prevention strategies. And so more than a decade ago, I realized that what I call the new science of the aging brain had enough evidence to enable the development of a healthy brain lifestyle, healthy aging brain lifestyle. And so I wrote this book, The Brain Training Revolution, and BrainSavers evolved from that. So let me tip my hat to everybody involved at the foundation. Carol Zerniel, the executive director, Laura Cisneros, who oversees all the community centers, Tina Smith, who is a great co-presenter with Carol and I and others at various meetings, and of course, Glenda. You all are probably aware that this foundation was started about 15 years ago by Dr. Rapier, who started the WellMed Medical Management Corporation. And you who have the availability of participate in the caregiver program and other programs sponsored by WellMed are truly blessed, because I know healthcare, and I know healthcare around the country and around the world. And I have no doubt that what WellMed does is at the cutting edge, and this Caregiver SOS program is one example. And all of you who provide caregiving are on the front lines. And I appreciate everybody who is involved in healthcare of patients with dementia, appreciate your steadfast devotion to a very difficult population, individuals. And finally, I would mention, if you're not aware of, the Brain Health Initiative that WellMed has launched within the last year. And this is a leading edge program that I predict is going to be followed. This model is going to be followed across the country. Okay, so today's objectives are really threefold: to look at risk factors for Alzheimer's disease and other forms of dementia, primarily stroke-related dementia, and how, once we recognize what those risk factors are, how can we modify them and literally prevent millions of cases going forward. And then, most importantly, what each of us can do in our own daily lives to reduce our personal risk of cognitive impairment and dementia associated with aging. And I think Glenda mentioned we'll save some time for questions at the end, so you can put them in the chat or ask them via your microphone. So here's the root cause of the increase in dementia. There are two major risk factors. Age is the predominant risk factor. And you can see in 2018, for the first time in this country, and this is repeated globally, for the first time, the demographic over 65 exceeded the population under the age of 5. And you can see that by the midpoint of this century, in just over 25 years, more than 15% of the population will be over 65. And that's the biggest risk factor for Alzheimer's disease. So when you're 60, you have a 1% chance of getting this disease. That more or less doubles every 5 years. Depending on which research study you look at, which epidemiological study, between 30 and 50% of individuals over the age of 80 will have Alzheimer's or another form of dementia. And Alzheimer's is by far and away the leading cause of dementia, responsible for about 70% of all cases. Now, the goal of all of us is to live as long as we're able in a healthy manner. And as far as our brains are concerned, the goal is to keep your brain as sharp as possible. Interestingly, the brain is the one organ in the body that actually increases its abilities with age. The older brain is more knowledgeable, it's more confident, it's more creative, it's better at making decisions. That's a normal aging brain. Let's do a little bit of anatomy. Is my pointer visible, or probably not? But you'll see right in the middle, the memory maker of your brain, that's the hippocampus. And it's a seahorse-shaped structure located above and behind your ears in the temporal lobe. And if there's one piece of anatomy in your brain that you want to protect and enhance, it's that hippocampus, because that's where memories are made. So, two fundamental principles underlie the new science of the aging brain. One is brain plasticity. We now know that even a 70, 80, or above in years aged brain can actually change its shape. You can generate new cells and you can connect them through what are called synapses. That's neuroplasticity, brain plasticity. Furthermore, we now know, and there's abundant evidence, that if you work at maintaining and enhancing your brain, you can build brain reserve or cognitive reserve, which is analogous to physical reserve. Even high school students have some knowledge that individuals who do some exercise, who eat well, they build physical reserve, which enables them to better withstand a case of the flu, a case of COVID, recover more quickly from surgery. That's physical reserve. Cognitive reserve is the same principle applied to the brain. It's an insurance policy against age-related cognitive impairment, and specifically, it's an insurance policy against Alzheimer's disease. So I want to make this point, and this is a table that I borrowed from the Alzheimer's Society of Canada. Normal aging affects the brain. The older brain is not as quick as learning new information. It's not as well equipped to remember things as a younger brain. But normal aging is not dementia. Dementia is not part of normal aging. So a normal aged individual may forget details, may not remember a name of an object or an acquaintance. And the worry is a healthy worry. When it's your relatives and friends that are worried about you, but you don't see a problem, that is a more serious issue. And as the table summarizes, individuals with dementia can't recall details from even moments or hours ago. They don't recognize families and friends. Their increasing forgetfulness impairs daily activities. And if those symptoms are present, an individual must be evaluated by a qualified healthcare provider. And again, the Healthy Brain Initiative that WellMed has launched provides that sort of intervention. So I mentioned that there are some changes in the normal brain with aging. And let me see if I can't read my own slide because there's, oh, here, now I've got it. Okay, so working memory, long-term memory, and short-term memory, they all gradually decline with age. But interestingly, verbal knowledge, your vocabulary, increases with age. And so I repeat what I said earlier, the aging brain actually is better equipped than a younger brain. Oh, my screen is frozen. Okay, is it visible now, Glenda? Glenda, is my...
Yeah, we can see it.
Okay, so I just to emphasize that structure in the middle of your brain on either side, in the temporal lobe, the hippocampus, which means seahorse in Greek. So, and as I said before, here you can see where it's located in this image in the upper right. The hippocampus is the memory maker of your brain. And it's the earliest place to show the changes in a dementia like Alzheimer's disease, which explains why often the presenting complaint by a family member is that the husband or the wife or grandparent is very forgetful, unable to remember details even of what he or she had for breakfast a few hours earlier. Here again, just to show you where the hippocampus is located. Now, here's the scope of the problem that we're faced with. As I mentioned earlier, we are an aging society. Today, there are almost 55 million Americans age 65 and older, and that number is going to almost double in the next 25 years. Currently, there are over 6 million of us, of Americans with Alzheimer's disease. That number is going to more than double by 2050 if we don't find strategies and adapt strategies that reduce the risk of this disease. 2/3 of all Alzheimer's victims are women, and 1 in 3 seniors will die with Alzheimer's or another dementia. And the economic costs to society are astronomical. Some medical economists predict that this one disease could bankrupt the healthcare system. This year, the direct costs are going to exceed 320 billion, projected to go to $1 trillion by mid-century. Now, a very hopeful finding is that at least 1/3, some authorities will say 50% of all dementia cases are attributable to modifiable risk factors. And what that means is they can be prevented. So what are the risk factors for Alzheimer's disease? The biggest risk factor is age, and that's unmodifiable. A family history of the disease, genetics are not modifiable. Existing mild cognitive impairment, that's when memory issues become severe enough that they start interfering with daily activities. In a significant number of cases, those are modifiable. And that's why everybody who's exhibiting those symptoms need to be evaluated, looking for risk factors and diagnoses other than Alzheimer's disease, causes of dementia that are treatable and reversible. I won't say anything more about Down syndrome. That's trisomy 21, individuals born with a genetic predisposition to overproduce the Alzheimer's amyloid peptide, which is neurotoxic. The 2 major modifiable risk factors are an unhealthy lifestyle and social isolation. And excuse me. And again, the WellMed community centers are a wonderful place to be socially engaged. So there are also a number of medical risk factors for Alzheimer's disease and all-cause dementia, which include stroke. And here's a list of those: diabetes, high blood pressure, obesity, smoking, obstructive sleep apnea and other sleep syndromes, abnormal sleep syndromes, excessive alcohol consumption, depression, impaired hearing, and impaired vision. All of these can be treated or modified. And by doing so, you significantly reduce your risk of dementia. So I'd encourage all of you who are caring for individuals to make sure that the healthcare provider assisting you is aware of any of these possible risk factors and they're being treated. I would emphasize the impaired hearing and impaired vision. Your brain thrives and actually evolved to handle sensory input. What we hear, what we see, what we feel, what we taste. And without that sensory input, the brain can't do its job. There are now many, many research papers documenting how people with impaired hearing or people with impaired vision have increased risk for Alzheimer's disease. So it's incumbent on all of us to use hearing aids if we need them to make sure that we optimize our vision. So this is a table from a major publication 7 years ago, sort of highlighting the risk factors, which I've already mentioned. I didn't mention cardiovascular insults. You see that there. And the protective factors. And we'll go into more detail on those here in a moment. So how can we modify those risk factors and prevent millions of cases? So over the last 10 years, and I'm proud to say BrainSavers was one of the pioneers here, strategies to promote successful aging, and specifically strategies to reduce the risk of Alzheimer's disease, have come to the forefront of this battle. Unfortunately, there are no medications that alter the course of Alzheimer's disease and some other dementias. Now, that's not to say there aren't FDA-approved medications. There are. And you've probably heard of some of them. Sept is the leading one. Those medications simply treat symptoms for a period of time. They don't change the underlying pathological changes in the brain. More than 300 failed drug trials in Alzheimer's disease as of now. So the only prevention strategy that has robust evidence is lifestyle. So this is from a journal, Alzheimer's and Related Dementias. And the summary was that research shows that a combination of healthy lifestyle behaviors may reduce the risk of Alzheimer's disease. Now, 7 years ago, the equivalent of a phase 3 drug study on lifestyle was published in The Lancet. And it's known as the FINGER study, which is an acronym for the Finnish Geriatric Intervention Study to Prevent Cognitive Impairment and Disability. And this was a 2-year multi-component intervention, which consisted of nutritional guidance, social activity, cognitive, in other words, brain training, brain exercises, physical exercise, and management of those medical risk factors that I listed earlier. Now, there were 1,200 people in this study. 600 of them got this multi-domain intervention. The other 600 were in the control group, and they received just regular health advice, no specifics. The primary outcome of the study was to look at cognitive performance as measured by some validated tests. And the secondary outcomes included how often participants developed dementia, what their disabilities were, depressive symptoms, and vascular risk. The outcome was conclusive. Compared to the control group, the participants in the multi-component intervention group scored higher on the battery of neuropsychological tests. Their memory function was 83% better, and their processing speed, the speed at which they process new information, was 150% higher compared to the control group. Now, we don't yet know whether these changes observed over 2 years translate into a reduced risk, a reduced incidence, I should say, of Alzheimer's disease. For that information, the group is being followed for a total of 7 years. This made such a splash that the American Alzheimer's Association is repeating the study. In science and in medicine, a single result is suspect until it's repeated in further studies. Scientific American published this on its cover to highlight this very rare success in the battle against Alzheimer's disease. And it was a summary of the FINGER study. So now everybody's jumping on the bandwagon. The Cleveland Clinic talks about 6 pillars of brain health: what you eat and drink, how much you exercise, healthy sleep habits, socialization, and managing stress. Harvard published the Guide to Cognitive Fitness, and they exactly duplicate what BrainSavers pioneered with our 6 components of a healthy brain lifestyle. And these are quotes directly from Harvard. Steady social contact protects your brain. You bet you can give your memory a boost through physical exercise. staying engaged with intellectually challenging activities keeps your brain sharp. What do we mean by intellectually challenging activities? Well, again, at the WellMed senior centers, you can find a host of activities, whether it's drawing classes, various other senior activities. The list is endless. Book clubs, goes on and on and on. Each of us has to find those activities which challenge us, not to an overwhelming degree, but engage our brain. One of the best ways is to learn a new language, starting with an introduction to Spanish or an introduction to French, and then keep at it. If you eat a healthy diet, you can reduce your risk of Alzheimer's by 50%. Sleep is critical for memory formation, so sleep issues have to be dealt with. And stress, and the best studied chronic stress is depression, can mimic Alzheimer's disease. In the past, depression was known as pseudo-dementia because, again, the memory impairments and other cognitive challenges, people who have chronic depression can look virtually identical to Alzheimer's disease. So what can each of us do in our daily lives to reduce our personal risk? I put this up there again. At least a third of dementia is due to modifiable risk factors. But what it takes is for each of us to be our own brain health quarterback. As my wife is so happy to point out time and time again, I can talk forever about this, about what results in meaningful changes are when individuals take up their own cause and become and adapt healthy lifestyle practices. So the program that we developed is the Brain Plus Body Total Fitness Program. And as I mentioned, WellMed has provided this prior to COVID in their senior centers. And it's an instructor-led class in which the 6 components of a brain healthy lifestyle are taught and practiced. So here they are. Using your brain, challenging it, being physically active, eating a healthy diet, and the Mediterranean diet is the best studied one. Becoming more socially engaged or staying socially engaged with families and friends, managing stress and restful sleep. Let's spend a few minutes, I think we have time, on each of these. So what are the benefits of socialization? A number of studies, and these were 2 of the early pivotal ones, document that individuals who stay socially integrated have less memory loss and delayed memory loss compared to their less socially engaged cohort. And it's actually possible to change the trajectory of cognitive decline by getting and staying socially involved. So at BrainSavers, we teach and urge participants to do socially engaging activities with family and friends. And again, the list is endless. Here are some senior center activities that WellMed provides. To greater or lesser extent, they all involve socialization. So again, I urge all of you to partake of this valuable resource in San Antonio and other cities where WellMed has senior centers. Now, what about physical exercise? This is the best studied intervention. And here you can see that new brain cells are being formed in the hippocampus. This is the area that's highlighted in color in these images. Individuals that exercise on a regular basis, and I'm talking about modest exercise. You don't have to be running marathons or swimming endless laps. What you need to do is modest aerobic exercise, increasing your heart rate and your breathing rate not to the degree that you're panting, but that you can feel you're making an effort. People that do that 30 minutes, 5 days a week, not only feel better, they are better. They have a decreased risk of heart attacks, stroke, and significantly of Alzheimer's disease. I just received this publication this week, and I should mention the publication is called Brain and Life. It's a publication of the American Neurological Association, and it's available to anyone at no charge, either online or in the mail hard copies. And in the most recent issue, they highlighted a study that's actually 20 years old now, and that's the London taxi cab study. If any of you have been in a London taxi cab, you know that they don't use GPS, they don't use maps. A certified black cab driver in London knows the entire central London area by heart. So if you want to go to Dr. Paul's clinic, the driver will say, "Right on, mate," and drive you there without any map or GPS. To get a certification in London, you have to pass an exam called the Knowledge. It takes on average 2 or 3 years of study to learn central London and then pass this exam. And way back in 2004, Dr. McGuire and her colleagues studied these cab drivers, and they found that those who had passed the test had statistically larger hippocampi, than those who had not passed the test. And specifically, the posterior part of the hippocampus, which we know is involved in geographic memory, was larger. So it's a fascinating example of neuroplasticity in the real world and the benefits from exercising your brain. Here's a study from Kirk Erickson and his colleagues at the University of Illinois, showing that with exercise, with modest physical exercise, both your left and right hippocampus enlarge. And, oh, I guess I took the next slide out. This enlargement of the hippocampus, physical exercise, is associated with reduced incidence of Alzheimer's disease. What about actually exercising your brain? This is a hard subject to study because it's difficult to measure. But now, over the last 20 years, hundreds of papers have been published demonstrating that there's robust evidence that doing mental activity, even starting in late life stages, is associated with a significant reduction in dementia incidence. So find activities that engage your brain, whether it's book club, learning a language, traveling to new places, planning those trips. All of those things, all of those activities result in increasing synaptic density, more connections in your brain, which provides that insurance policy against memory loss and Alzheimer's disease. What about nutrition? We all like to eat. What's encouraging over the last 10 to 15 years are the studies that demonstrate that if you eat a more healthy diet, less processed food, more whole fruits and vegetables, more fish, less fatty red meat, use healthy oils like olive oil, you can very significantly reduce your risk of Alzheimer's disease. These studies have been pioneered at the Rusk Institute in Chicago, Columbia University in New York, and other academic centers around the world. Dietary intervention can significantly reduce the risk of cognitive decline and the risk of dementia and Alzheimer's disease. Here's the Mediterranean diet in a pyramid form, and you can see most of your meals should consist of whole grains, fresh fruits and vegetables, leafy green vegetables, nuts, seeds, low-fat dairy, fish rather than red meat. What's missing at the top here, when it's kind of a standard part of the Mediterranean diet, is a glass of red wine. But I always say you can get 99.9% of the benefits of the Mediterranean diet without alcohol. So if you don't drink alcohol, don't start. If there are medical or religious reasons not to consume alcohol, don't. But a glass of red wine or the equivalent on a daily basis has actually been shown to be beneficial to health. I mentioned sleep. Sleep is critical for your brain. I'm sure virtually all of you have experienced a night of not restorative sleep and you don't feel well the next day. You don't feel mentally as sharp. Well, now there's very abundant scientific evidence that during sleep, not only does your brain recharge itself, but it's during sleep when memories are made permanent. And so sleep deprivation impairs memory formation, and it's now been shown to be a major risk factor for cognitive impairment and Alzheimer's disease. And number one among the sleep disorders is obstructive sleep apnea. So abnormal snoring, the cessation of breathing for prolonged moments during sleep, those are signs that need to be reported to a healthcare provider, a physician, and investigated. And finally, but very importantly, stress. I mentioned that the best studied chronic stress is depression, and depression can mimic Alzheimer's disease. None of us enjoy stress. Short-term stresses are actually somewhat beneficial to overall health in that they prime us to take action, so that the stress of a fire alarm tells us to get out of the building. What our brains have not evolved to handle are the chronic stressors of modern life, drug and alcohol abuse, long, drawn out divorces, having children who have serious emotional and or physical problems. So each of us has to find a way to manage stress, reduce stress, because it's beneficial not just for overall health, but for brain health specifically. Now, in the last few minutes here, I want to summarize. So we can have all the knowledge in the world. That's not enough. We have to apply that knowledge. And willing is not enough. We must actually do. And that's a quote from the great German author Goethe of 200 years ago almost. And Dr. Gina Touch-Mercer, who's a colleague of mine at the medical school here in Phoenix and is our VP of Cognitive Science, she's developed a whole program that we've incorporated into the BrainSavers Brain Plus Body Total Fitness program, talking about attitude and the science of change. And I just summarize a little bit of that here. There's a myth about change that simply doing something New Year's, like joining a health club, is going to work. In fact, only 1 in 5 people kept their resolution. 77% quit after 1 week. Change takes much more than willpower. Willpower, the myth is that's all you need to change. And not having willpower was the top reason given by individuals who dropped out of programs, not following through with health changes. The fact is readiness. You have to be ready to make change. That's the main ingredient. So in summary, this is from the National Alzheimer's Institute, makes brain healthy lifestyle changes by adapting brain healthy lifestyle interventions. We could realize a future without Alzheimer's disease. I want to acknowledge people on the BrainSavers team who have enabled me to get up here and talk about this. Angie Moore is our programs director and our fitness guru. I mentioned Dr. Gina Touch Mercer, who's a behavioral neuropsychologist. Craig Ullman is our chief operating officer. Ben Smith is our chief development officer, and Patrick Spear is the chairman of our board. So I think with that, I'll stop and thank you all for listening. And I think we have some time for questions, Glenda.
We do indeed. We got about 15 minutes. So if you have a question, a comment, something specific you'd like to ask Paul about, please just unmute your microphone and I will call on you by your name. The chat box is open and you can post your question or comment there. And we'll be happy to join in a conversation. Yes. Oops. It was unmuted and then it was muted again. Clarissa, please go ahead.
Yes. One of my questions is, has there been any studying that we are setting up the population for more Alzheimer's because we are making things so much easier? Because the interesting thing you said about maps, about learning the maps of the city, the gentleman, they had to learn the maps of the city. I was informed that the only reason that military men were not accepted into the service could be if they could not read a map. And our children do not have a grasp of the areas that they are in because they always have gone to MapQuest. When we grew up, we had to learn where the city are. We know which streets split the city, whatever it is. And so are we dumbing down our population with the new, easier ways to find something out? Children can go online, they can get the answers to all their problems, that kind of thing, so that we'll have more dementia than we have now.
Clarissa, that's a great question. I don't consider myself qualified to answer it in great detail. And it's an area of very intense study. I think most of us in the field recognize that what you say is, at least to some extent, very true. That we know that a risk factor, and I didn't emphasize this, one of the, well, I should say the prevention factor of dementia and Alzheimer's disease is education. The more education you have, you're building more brain reserve, you're raising the threshold, you're lowering the chances of getting dementia and Alzheimer's disease. So I think the key is to make sure our education system, and that includes what parents talk to their children about around the kitchen table, the dining room table, and the reliance on devices rather than reliance on this device, the 20 muscles inside your brain, can't be beneficial. Now, obviously, we all need certain devices to enable a modern lifestyle. So there needs to be a balance found between using your brain as it evolved versus using devices to substitute for your inherent brain power. I hope that's somewhat of a satisfactory answer to your question, but I think you're onto something. And I think many researchers in education and cognitive neuroscience, brain neuroscience, would agree with you. And again, it's got to start with our children. They need to be educated. They need to be taught to rely on their brains, not on a device all the time.
Okay, and the other thing is, with the advent of the drug era, I guess that's around what, 60, is that going to be a factor? Because that's just an unhealthy, something in our environment that's just unhealthy, that's just
yeah,
really
Yeah,
causing problems.
absolutely. I mean, you're talking about illicit street drugs, which are
Yes.
absolutely not only deadly, but to people that don't die from them, it's dangerous to their overall health, their cardiac health, and their brain health. But even prescription drugs, if they're
Mhm.
abused, are detrimental. I mean, I can't even begin to recount the number of patients I've seen who are on a whole host of medically prescribed drugs, but that are interacting and causing cognitive impairment. The best known are the sedatives and tranquilizers, drugs like the benzodiazepines, Valium, and the like. But so that's, again, a very good question. And that's why, again, anybody showing signs of memory impairment or other diminishment of their cognitive brain function needs to be evaluated by a qualified healthcare provider. And at the very first visit, they need to take with them a list of the drugs they're taking, both over the counter and prescribed, because more often than not, that's one of the factors that's involved in the cognitive impairment.
Thank you.
So I tell my patients they should have a list in their wallet or in their pocketbook of their drugs, because in the case of an emergency, the physicians in the emergency room can save a life by having that information.
Excellent questions, Clarissa. Thank you for bringing that up. Suzanne had a question. For Uber introverts, socialization suggestions, please. Somehow something always comes up to prevent it. And the first thing I thought of was, well, she's with us here, Paul. So that's sort of a socialization event.
Yeah. So what I missed the first part of for.
She's an introvert, and she has difficulty and challenges with socialization, and she understands how important that is. And did you have any tips?
Well, I think the individual who, or the healthcare provider who could be most helpful would be either a social worker or a psychologist, to enable the individual to discuss what their fear of being more socially active is. Because once you identify the etiology or the cause, then you can do something about it. There are a number of self-help books that could be useful. But even somebody who's homebound and who's socially isolated because of that, picking up the phone and talking to a family member or a loved one, a friend, or joining a club, a group of others who are socially isolated. All of those are ways to maybe dip your foot in the waters of becoming more socially active.
Yeah. It's not something that comes naturally to everybody. And my suggestion is it's something you really have to work at. I even do that myself. I'm a widow, and so I have to work at socialization.
Yeah.
It takes time and effort, and
it does.
hard for caregivers.
Yeah. And I think there's that fear of being rejected or not finding what we want. I've found, again, through listening to people that participate in community centers, social centers, if you have a friend or a family member who goes, but you can't get your own willpower to force you to go with somebody for the first time, the first few times. And I think most people will find increasing comfort and evolve to the point where they feel they can go by themselves.
Yeah, that's a great idea. Let's see, over here on the chat box, Scott Seeger, he says pharmacists can be a key as part of a medical team. We know that's true. Thank you, Scott. Anyone else have questions, comments, something that you'd like to talk about related to brain health?
Yeah, let me go back. I threw a lot of information and suggestions out there, and it can seem overwhelming to some people who don't feel they have a brain healthy lifestyle. So it's all about taking small steps. And let's say you're doing none of those 6 components. Start with a modest amount of physical exercise. Put on comfortable shoes and go out of your house and just walk for 5 minutes in the fresh air. That's a beneficial way to start. It's a stress reducer. And most people who do even very minimal amounts of physical exercise, because they haven't exercised for decades or whatever, will feel better. The key is get those shoes on if you're going to walk, and do it day after day, and don't demand a lot of yourself. The first week, just go for 5 minutes. And at the end of that week, if you're saying, hey, I think I can do a little more, go for 7 or 8 or 10 minutes and gradually build up. And I would predict you'll meet other people while you're walking, and you may socialize a little bit with them. People that exercise start thinking about the fuel they put in their bodies, and they may start eating a more healthy diet. And it can all evolve from a very small first step.
Yeah, right. I love what Sandra said in the chat box, Paul. She said a benefit for going to group exercise classes by herself is that others reach out, and so does she. So, you know, that's a good socialization, and getting 2 things at once, right?
Absolutely. And what we found at the BrainSavers classes is people meet, they get to know each other a bit, and they start doing things outside of the class. I'll never forget when we first started BrainSavers, there was a group of 4 women that were just rah, so happy with the program, and that they were doing it for 6 months, and then it was started for another 6 months, and they weren't there. And I bumped into one of them in the community room, and I asked her, how come you dropped out? I was personally hurt. She said, Dr. Paul, because we learned that there are all these other activities that are beneficial. So we're doing Tai Chi. It's at the same time now as the BrainSavers class. So with that, I felt like we had accomplished something positive.
Well, just like what she said, I know that I was new to this community, et cetera. And so I went to an exercise class like she was talking about. And now all these years later, I'm just like what you were talking about. I'm doing so many different activities that I wasn't involved at the time, but I met people that had shared interests. So now I'm, play cards once a week, go to plays with these women that I met at this exercise class. So I think it's a great way to go forward.
Yeah, that's a perfectly valid testimonial. And I think all of us, even when we were younger, there's a fear. Change is difficult, and there's a fear of trying something new. But there's nothing wrong with failing at a certain thing as long as you give it an honest attempt. So if you decide that you want to learn Spanish, for instance, and you go to a Spanish class and you say, nah, this is not for me. Well, try French or try something completely different, like a book club or whatever. But getting engaged and overcoming a fear of failure, I think, are critical to healthy aging.
Yes, I agree so wholeheartedly. And my mother always told me that it was harder to make friends, make acquaintance when you get older. But I'm not sure that I agree with what she said, because I think there's opportunities for each of us. I don't know what it might be. It's different for me than you, to get out there and meet other people.
Yeah. And another wonderful activity is for individuals who are retired, or even if they're not retired, for looking for something new, is to volunteer. Volunteer at a school to be an assistant, volunteer at a community center, volunteer at an animal shelter. There are 1,000 ways for you to contribute to your community through volunteer. And it's a way to socialize. It's a way to learn something new. And it's almost always gratifying.
Oh, absolutely. Absolutely. It gives you a good feeling to do those activities. We have a couple of minutes left. And before I ask for any final question, I want to tell you what's coming up on the Caregiver Teleconnection. Tomorrow, I'll be back with you with Lucy Barreluk, and we're going to be talking about safe medications. kind of feeding into what we were talking about, Paul. This was scheduled to be part 2, but we canceled last week, and so we are doing part 1. So you didn't miss anything if you thought you might have. That's at 10 o'clock Central Time, so join us for that. And then on Wednesday, September the 28th, Dr. Elliot Montgomery-Sklar and Lucy Bearlock will be back with us again, talking about COVID-19, monkeypox, and the flu, because we are coming up flu season and COVID is continuing. Monkeypox is sort of new, so they want to talk to you about all of that. That's Wednesday, September the 28th at 10 o'clock Central Time. So join us for those sessions as well. Remember, these podcasts are posted. You can visit the Caregiver Teleconnection website, and you're going to find so many topics and speakers. I think you'll be surprised. So we have about 1 minute left. Does anybody have a question or comment before we close?
I see Ruth Cobb's there, like she wants to ask a question maybe, but she's muted.
Let's see, Ruth, or did you want to ask a question? Okay, you need to, let me see if I can, where are you? Maybe I can ask you to unmute, and if you click on that, Ruth, I think we'll be able to hear you. Maybe. There you are.
Yes. I had a rather bad fall last November. It was never followed up on by the doctor. He did not feel it was necessary to do anything. However, I believe I had a concussion along with this. What do I need to do? Now, this is almost a year later. The interference came when my husband, who was in memory care, passed away. And he passed away from COVID because he was in a memory care and someone brought it into it. So my needs kind of went unnoticed. Is there some way I should be following up on this now a whole year later?
Yeah. Oh, Ruth, let me first say I'm sorry about the loss of your husband and
Thank you.
all and all the repercussions. So I think I would suggest that you make an appointment with your doctor and explain what you've just explained to us in more detail. And it may be beneficial, again, the Brain Health Initiative that WellMed has launched. You would qualify to be evaluated under that initiative and to see if there's a need for intervention on the cognitive side. And your doctor will ask you the right questions about what we call the post-concussive syndrome. And I don't think this is the time for me to go into that with you. I'm not your doctor, but I would specifically ask for an appointment to explore what happened and if you're suffering from what we call the post-concussive or post-concussion syndrome.
Well, I have found that occasionally when I am driving or whatever it is, because I still drive my car, that I will get a little bit like a dizzy feeling, and it is momentary, but still at the same time it's bothersome to me.
Sure.
Because I don't want this feeling of momentary dizziness to interfere with driving and cause an accident.
Yeah, well, I applaud your responsibility there. So again, dizziness covers a lot of possibilities. And so if your primary care provider feels it's necessary, he may refer you to a neurologist or perhaps a cardiologist to look into possible causes of those symptoms.
Bruce, thank you for bringing that up. We have
Okay.
gone over, and so please contact your local physician, your primary care, and ask for his assistance with that. Well, I want to thank everyone for being with us today. I know you have busy days if you're a caregiver. Want to thank Paul for joining us today and sharing this wonderful information. You will be receiving a follow-up email. I'll put a couple of the resources that Paul mentioned in his presentation there for you. We'll also ask for feedback. If you have any presenters you've heard somewhere, a topic you'd love us to cover, let us know about that, as well as how we did today. So Paul, thank you so much for being with us, and I look forward to working with you again sometime.
It's been my pleasure. Thanks so much, Glenda, and all of you for your questions and for your attention.
Thank you so much, and we will see you again soon. Bye-bye.